Good afternoon. I'm Greg Hart, Chair of the Santa Barbara County Board of Supervisors. This press conference is broadcasting on County TV Channel 20 and the county's YouTube page. The meeting is being interpreted in American Sign Language by Joe Black. Carlos Saracito is interpreting the press conference in Spanish. This interpretation will be available on the county's website and YouTube page shortly after we conclude this press conference. Today at noon, Governor Newsom announced a significant change in the statewide framework for evaluating the status of COVID-19 in California counties. The new framework changes the previous state monitoring lists on-off approach to a new graduated system. The new state framework is still based on local COVID-19 positive cases and the local test positivity rate. The State Department of Public Health will calculate the daily average for the past week in each county and announce the status of each county once a week on Tuesdays. The state's new system is now color-coded to make it easier to understand the progression from one tier to the next. Each county in California will be assigned one of the four colors, purple, red, orange, and yellow, based on the new daily cases and local test positivity rates. The color purple has been assigned to designate counties that had previously been on the state's COVID-19 monitoring list. Santa Barbara County is designated as a purple county. The vast majority, 87% of Californians, reside in counties that are now designated purple. Only 12% of California residents live in counties designated at the next tier, which is red, and 1% live in designated orange counties. Less than 0.1% of Californians currently live in the very rural yellow designated counties. Governor Newsom explained that counties must stay in their designated tiers for a minimum of 3 weeks before moving to the next lower tier. This structure is designed to ensure that COVID-19 cases do not spike because businesses reopen too quickly, as occurred with the first round of business reopenings in July. In order to move to the next less restrictive tier, a county will need to demonstrate that it meets the goals of the less restrictive tier for a minimum of 2 weeks before being formally moved into that new tier. The two metrics to be utilized in determining movement from higher tiers to lower tiers will be new COVID-19 positive cases per 100,000 population and test positivity rates. Both metrics must be met to conform to the state guidelines before a county may be moving from one tier to a lower level. Purple counties have more than 7 cases per 100,000 population or a higher than 8% test positivity rate. The red tier allows 4 to 7 new cases per 100,000 population or a 5 to 8% positivity rate. The orange tier allows 1 to 3.9 daily new cases per 100,000 population or a 2 to 4.9% positivity rate. And the yellow tier has less than 1 daily new case per 100,000 population or less than a 2% positivity rate. Our county's nearly 450,000 population translates into a COVID-19 positive case threshold of no more than 32 daily positive cases. Yesterday, the Public Health Department announced 35 new cases. Our weekly average is higher than that, but we are close. Our test positivity rate, the other metric the state considers, is already low enough to move to the next lower tier. Beginning today, the state's covid19.ca.gov website has been refreshed to incorporate the new 4-tier county ranking system. A new feature on the Blueprint for a Safer Economy tab of the refreshed covid19.ca.gov website is the ability to search by county and business activity to learn specific restrictions and requirements. The previous COVID-19 county watch list system did not provide any transparency to the path that closed businesses could follow to reopen. This new graduated state system allows businesses to clearly see the path ahead for the gradual reopening of all remaining sectors. As the rate of transmission declines in each county, more businesses will be allowed to gradually reopen. In addition to unveiling the new state business reopening framework, Governor Newsom also announced that barbershops and hair salons will now be able to reopen indoors in all California counties. Our county public health department will be working this weekend to modify our local health order to conform to this new state guidance. Barbershops and hair salons will be able to reopen indoors early next week. This new state framework is very significant news and is possible because Californians are working together to reduce the spread of the coronavirus. Santa Barbara County residents have been doing our part, and our numbers are declining. While we are not yet at the stage here in Santa Barbara County where we can move to the next lower tier, we are very close and making good progress. Our successful transition to the next tier and even more progress will depend upon the effectiveness of our collective action together. Please redouble your commitment to maintaining physical distancing, wearing face coverings, and washing hands. What we are all doing together is working. We know that our youth are under extraordinary pressure during these uncertain times. For years, improving the mental and emotional wellness of our youth has been a top priority for all serving young people in our county. This effort is more important now than ever before. In late July, the County Department of Behavioral Wellness, the County Education Office, and the 20 school districts throughout the county were awarded $4 million grant from the state to increase access to mental health services for K-12 students. These efforts over the next 4 years will especially focus on assisting students who have been historically underserved, including LGBTQ youth, youth in foster care, and youth who have had disciplinary issues at school. Additionally, this grant will equip local educators with mental health first aid skills. Although distance learning is an important tool for preventing the spread of COVID-19 in our community, we must also provide our youth with the support that they need. Our educational leaders are working hard to ensure that local children continue to benefit from the supportive relationships that they've had with their peers and teachers. It's important that our local youth and families understand that it's okay to ask for mental and emotional wellness support during this challenging time. Youth who are experiencing anxiety, depression, or other mental wellness challenges should know that they are not alone and that there are many caring adults who are eager to help. Youth can reach out to their schools at any time to ask for assistance, and people of all ages can also contact the Community Wellness Team for support by calling 805-364-2750. Next, we have Dr. Vonda Reynoso, Director of the county's Department of Public Health.
Thank you, Supervisor Hart. Today, we are reporting 67 new cases. We currently have 246 cases that are still infectious in our community. Currently, 40 people are hospitalized with 21 in the ICU. We are unfortunately reporting an additional death of a person over 70 years of age. This person had underlying conditions, resided in the city of Santa Maria, and was a resident of a congregate living facility. Our total case count today stands at 8,014. As Supervisor Hart mentioned, Santa Barbara County is on Purple Tiered 1 due to our case rate of 9.0. However, our testing positivity rate is 6.5. Under this category, there are only a few sector changes from the current status. We will be working over the weekend on a health officer order to allow hair salons, barbershops to open indoors with modifications. All retail open indoors with modifications at 25% capacity. And looking at shopping centers such as malls, destination centers, swap meets with modification at 25 capacity. Under this new reopening framework, counties will remain on each tier for a minimum of 3 weeks. In order to move to the next less restrictive tier, a county will need to demonstrate that we can meet the goals of the less restrictive tier for a minimum of 2 weeks before we can be formally moved out of that space. Needless to say, this new state framework is sudden and complex. We are evaluating the impact to Santa Barbara County, and in particular, how we can share the new data metrics in a way to you that makes sense. Now I'd like to give an update about our state-sponsored testing site currently located at the Earl Showgrounds. We will be moving it to Goleta Valley Community Center. The last day of testing services at the Earl Showgrounds will be August 31st. Testing services will begin on September 3rd at the Goleta Valley Community Center. Testing appointments can now be made for the Goleta site online at https://lhi.care COVID testing or by calling 888-634-1123. The Goleta Valley Community Center location offers residents of Goleta and Isla Vista expanded testing opportunity by proximity to and ease of access by public transportation. I'm happy to report that our case rate and testing positivity continues to trend downwards. However, I can't stress enough for everyone in our community to commit to wearing your face covering, maintaining physical distance, and limiting gatherings and crowds so that we can move to the next tier. Let's set our goal to advance into the next tier by the end of September. In addition, the California Department of Public Health has been issuing new guidance by providing new options related to schools at a rapid pace. It is helpful to have that flexibility so that we can expand our local approaches, and it's been great to receive more clarity from the state. However, these rapid new directions from the state also brings challenges since they arrive with little notice. With the TK to 6th grade waiver process and the additional guidance from on cohorting 0 to 18 years old, we recognize that the additional uncertainty and rapidly changing options can be unsettling and confusing to community members, staff, parents, and students. We recognize that schools and districts want and need to provide stability. The Public Health Department supports local decision-making that is thoughtful, allows for stakeholder input, and has planned transitions. By taking time to consider new options and guidance, school leaders are providing community stakeholders with opportunities to learn, understand, and transition. And we will continue to provide technical assistance to the school districts as part of our COVID-19 response efforts. We're also supporting another group of essential workers, our food processing and farm workers. Santa Barbara County is launching the Housing for Harvest program on Monday, August the 31st. The Housing for the Harvest program is designed to provide temporary hotel housing options for essential farm and food processing employees who are either COVID-19 positive or have been exposed, who do not require hospitalization to have a safe and suitable place to isolate and who are unable to do so at home. This project is a partnership between the State of California, the Santa Barbara County, and Family Services Agency. In closing, thank you for doing your part to keeping our community safe. Your personal behavior and our group behavior will have positive results for the whole community. Everyone benefits when we wear our face coverings, when we maintain the physical distance, when we stay home when feeling sick, when we avoid crowds, and when we postpone gathering with people from outside our household. Thank you.
Thank you, Dr. Del Reynoso. Next, Dr. Henning Ansorg, the Santa Barbara County Public Health Officer, has his remarks.
Thank you, Supervisor Hart. Good afternoon, everyone. We are pleased with our continuing downward trend of county-wide new COVID cases and hospitalizations over the past week. Wearing a face mask is one of the most powerful tools we have used to limit the spread of COVID. New research shows that wearing of a mask in conjunction with social distancing and good hand hygiene provides the best protection from contracting or spreading the virus. Regarding school reopening, we are reporting that as of today, we have received 13 elementary school waiver applications requesting to open for in-person instruction. Of the 13 applicants, 1 is a public school district and the other 12 are private schools across the county. We are actively reviewing these applications and are in communication with the individual schools for additional information if needed or for clarification on their safety protocols. Once we have reviewed an application, it will get forwarded to the state public health department for their approval or denial of the request. The state is posting the status of each application on their website on the CDPH/COVID-19 webpage. Additionally, we are diligently assisting our school districts to set up routine COVID testing for their teachers and staff as mandated by the state. Furthermore, in an effort to limit gatherings and overcrowding on beaches, we are restricting the beach access for the upcoming Labor Day weekend, in a similar fashion as we already did over the 4th of July weekend. As a reminder, mixing and mingling with people not from our household, as well as participating in events and parties, are activities that have shown to spread the virus widely. We believe that the restricted beach use over the long weekend will be instrumental in reducing local COVID transmission. Again, everyone, please let us continue with our effective measures to get through this pandemic together. Thank you for your cooperation.
Thank you, Dr. Answer. I'd also like to welcome Hilda Maldonado, the superintendent of the Santa Barbara Unified School District, who's here today to share information about the collaborative partnership between the County Public Health Department and local schools. Welcome.
Thank you, Supervisor Hart. Thank you to the community, to our parents, teachers, and students as we navigate these times together. And I'm so heartened to hear about the new program from the state that shows the need to have a methodical and thoughtful approach to how we do this work as we in a school district try to process all the information that's coming our way. We have had some success in opening our schools in a distance learning model. I'm happy to report that 70% of our teachers have chosen to teach from their classrooms. We have had good connectivity in our Wi-Fi. We're proud of our attendance rates. We know that children and parents are eager to get back in schools. And I'm also seeing some incredibly talented teachers that are making the best during these times as they deliver instruction. With those successes, of course, come some real challenges. As you mentioned, we are concerned about the mental health status of some of our students. We want to make sure that our students are engaged beyond our Wi-Fi connectivity, but also connected to their peers, their teachers, and others, even though they may not be in the same classroom. We are concerned about children's sense of isolation, but we are also trying to work hard with partnerships to create some safe spaces for students to study and learn through our academic learning centers. And we continue to inform our students the opportunities for them to acquire any mental health or social emotional health services. We are very proud of our collaboration with the Public Health Department, who has been keeping us abreast of all the ever-changing guidance. And as we try to make sense of all of it together with you, we are also taking a very methodical approach. Our school board members and I are on the same page that we want to take time to survey how everyone feels about coming back to school, whether they agree with the ability to be ready or not, whether they feel safe. We want to understand what concerns they have and what are things that we can do to make sure that that not only we create a safe space, but people feel safe in that space. And we are continuing to partner and think through what will it look like when we do have testing available, what are the processes, the procedures, the difference between regular testing versus an outbreak and what that will look like, how we will manage that, how we will handle if a teacher does. Thankfully, none of our teachers have gotten the virus, how we will handle that in our classrooms and in our spaces so that we are careful with all of our implementations. So we will be taking our time. We will be looking and following carefully your health and safety requirements and just continuing to plan to collaborate with our community partners and really think that working together will make this happen well. More than anything, I want to also say to our students, if any students are listening to us, we are working hard to make the best experiences. I know especially I've heard from our high school seniors who really want to have a good high school year, the last year in school to be their best. We will continue to plan and work together and want to hear from you. So let us know how we can do better. And thank you for the collaboration and the guidance.
Thank you, Superintendent Maldonado, for joining us today and for your leadership in service of students, parents, and teachers in our community. We'll now go to questions from the room. Mr. Devine?
Before I begin, could I just clarify the case rate per 100,000 and the case positivity rate in our county right now?
According to the new framework, it is 9.0, and the testing rate is 6.5.
And just to clarify, to be out of the purple zone, we need to be below 7? For the
Correct.
case rate? Okay, thank you. First question, I guess, with the beaches being closed on Labor Day weekend, isn't that more likely to possibly result in backyard parties, which is a much more common way to spread the virus in close proximity if you compare that to the beaches?
Our experience on over 4th of July weekend was very well received and was very good in limiting parties at the beaches. We did not get any complaints about more activity going on otherwise. So we are hopeful that this will be a very effective measure.
And then why the move from Earl Warren to the Goleta Valley Community Center? You said transportation was the main thing, but what about all the people that were very close to Earl Warren?
So we had always intended to move towards Goleta so that Goleta and Isla Vista residents, community residents, who may not typically have access to a testing site and who are dependent on public transportation or walking to be able to access that site. We have been at Earl Warren for over, 4 months, and so we believe that this next move to Goleta will increase the opportunity of testing for those residents in those two communities.
Do you expect it to translate to a quicker turnaround time?
So we have had, the state has improved on the lab processing. So we went from anywhere from 5 to 10 days a few months ago. So we checked, and with the latest set of numbers, it looks like we've cut that down. The state has cut that down by half.
Okay. And then you guys mentioned possible routine COVID-19 testing for teachers and staff for the in-person. If that happens and when, how would you guys be able to do that?
Well, we are assisting the school boards, the districts, in setting up regular testing capacity for their teachers and staff that is mandated by the state. That similar to nursing homes, where staff of nursing homes has to do regular surveillance testing to make sure no COVID gets carried into the facility. In a similar fashion, we want to make sure that no asymptomatic carrier or spreader is going into the schools. And the timing or the time frame of those protocols is a little less frequent than in nursing homes. It's recommended by the state to have all teachers and staff be tested about every 2 months. And that can be staggered, that, for instance, you test 25% every other week or so, and then you get through the 2 months for everybody. That will be, of course, decided by this school with our help, because if you have a big school district with a lot of employees, that is challenging logistically, and we understand that schools haven't been asked to do anything like this. So we are very happy to help and set that up for them. We do not have the capacity, however, to run the tests ourselves. We will have to rely on other labs to do so, and we will happily give advice to the school districts how to get through this logistical challenge in the beginning, and so that is our plan.
You mentioned the schools and how you got the applications and you're reviewing them right now. When could we see these schools be open?
That all depends if the state is approving. The waiver process starts locally. We are reviewing every single applicant, and we are committed to passing it on in a very reasonable short period of time. And then we have to wait for CDPH to weigh in. So it literally depends on probably also their backlog. I hope that they have recruited more people to work on this, but it's all a very new process, and we will see. Unfortunately, I cannot give you an estimated time of starting school.
Lastly, hair salons and barber shops, when do you guys predict them to be able to open in our county this next week?
So according to the state, they can open on Monday. However, we will be working through the weekend to write our health officer order to allow for that. So,
Thank you.
Next, we'll answer questions on the phone.
Yes, first up, we're going to Josh Molina with NewsHawk. Go ahead, Josh.
Yes, this question is for anybody on the panel, but it feels as though with 12 private schools who've applied for the waiver and only one public school, which is probably a smaller school in Montecito, it feels like a two-tier sort of system, or not system, not like, it's structured that way, but we have a situation where we've got private kids who might be going back to school, private school kids, public school kids who are not. And I'm wondering if anybody could sort of talk about whether that's the appropriate sort of way to have elementary school kids interfacing with education in our community.
I'll start by answering your question, Josh, because it's a very complicated circumstance we find ourselves in. First off, the guidance and the local data from the state and in our own community have been changing very rapidly. And so we have been struggling and trying very hard to communicate that information very quickly to the school districts, which has been a challenge at our end and at the state end and at the school district level. So I think it's a natural outcome of this rapidly changing moment that there is going to be time that is needed to have the deliberative conversations with the school communities, as Superintendent Maldonado described. And at the public school level, that is a much more complex conversation than it is at many of the smaller private schools. So I think it is simply a function of the rapid change that has occurred in just a matter of weeks when we were not on a path to having this waiver process, and then getting the information from the state, from their data system was finally fixed, that showed that our numbers had improved to the point where this was a possibility, and then communicating about all the testing that is needed by the state guidance and the capacity and the resources that we have at the county and with other private testing labs, communicating that to everybody has taken a little bit of time, but we are collaborating really well and getting that information and working to resolve each one of these issues so that the local school districts can make the decisions best for their own students and teachers and parents.
Thank you. Does the county have the ability to step in if we were to see one of the private schools sort of have an outbreak or a few cases? Does public health have the ability to go in and say, okay, we're going to have to close this school to in-person learning now?
Yes, absolutely. Whenever there's an outbreak at a school, public health has to be informed immediately, and we will collaborate with the school leadership on the safest way to approach and deal with this outbreak. We have done this in the past with other infectious diseases very successfully and frequently, and we are well prepared to do the same with COVID.
Okay, just two more things. To Hilda Maldonado, what are the factors that have led to Santa Barbara Unified not seeking a waiver for its elementary school students?
Well, we're still waiting to get the results from the surveys of our families. As Supervisor Hart said, it's a little different in a public school because we need to have authentic outreach efforts to our families. So currently we send out a parent square, and most parents who have technology, who speak the language, can easily respond. Last night I was on a meeting with our parents of our English Learner Committee, and they said to us, you know, some of our parents don't just click their phones open and start to click answers. They need us to really call them and explain and speak their language and ask them these questions, ask them their concerns. So today we gathered a lot of our staff together to make those phone calls and get authentic responses from our families and not let others speak for them, so that we really have a good, clear understanding of where people are. I don't have the results of those yet, and I'm also seeking to get at least a 70% participation rate in our survey before I can say this is how people really feel, and we haven't reached that threshold yet. We also are doing the same with our community partners and other people who are working in partnership with us to collaborate and make sure that we are successful. We also, as a school district, because we are one of the larger school districts in this area, have to take into account our teachers who have underlying conditions, who are older, who also are going to need accommodations that are different than our younger teachers who may not have a higher risk. In addition to that, we have teachers that are elementary teachers who are married to high school teachers. And so when we think about contact tracing and infection rates, we are part of a larger community of people and aren't in a bubble, if that's a good way to say it, as a whole.
Okay, thank you. Last question. I saw a press release that there are 19 more cases in the county jail. And I was just wondering if we know how those cases or how COVID is getting into the jail in the first place for it to spread among the inmates.
That press release announcing those additional cases at the jail only came out at 4 o'clock today, so you'd have to contact the Sheriff's Department directly for that information.
Thank you, Josh. Next up, we're going to Nick Welsh at Santa Barbara Independent, who will be followed by Tom Bolton at Newshawk.
Hi, thank you very much. I'm trying to get clarification on the purple zone change. What will the effect be in terms of businesses that are currently operating? Will being in the purple zone be more restrictive on their operations than they currently are, or will it be the same?
It will be, it will be the same, but in addition, there's more latitude. Currently, we do not have hair salons and barbershops open. And so by being on the, in this new framework and in the purple tier, those sectors can open with modifications.
Okay. And when was the last time we hit 32? You know, where we had 32 new cases in a day, which would be the 7 threshold. How long has it been since we've been that low?
That's a great question, and I don't have that answer. So I'm more than happy to prepare that and send it to you, Nick.
Okay. And last, I wasn't clear just on the logistics. So we have to hit this threshold for 3 weeks, but we have to do it 2 weeks in a row. So I'm not quite clear how those two jive.
So it is really complex, and so we've only had a few hours to digest this, but our understanding is this. We need to stay on the purple. However, the state did disclose to us this afternoon that even though we are on the purple tier 1, we have a week credit of being in the red. So it just takes us 2 more red weeks in order to be able to move into the red. So.
Okay. All right.
Just a county would have to meet the criteria in the next tier for 2 weeks before the county can be moved into that next tier, if that makes sense.
It does. Thank you. You said this was sudden. How sudden was it?
We were We were on a call with the state on Wednesday night, on Thursday night, and this morning. So it was on Wednesday night, we received a sketch, not a lot of details. On Thursday night, we received a little bit more details, but not the full story. And I would say that even this morning's call, we received some additional information, but really not the total story until this afternoon, when the documents were posted.
Okay. Thank you very much.
Thank you, Nick. Next up, we're going to Tom Bolton with Newshawk.
Well, thank you very much. Question for Dr. Del Reynoso. With the change in the testing site, I'm wondering, do you expect or do you anticipate any change in the capacity of testing? And also, do you expect any change in the criteria for who can and should get tested?
Right now, our Santa Barbara site at Earl Warren is at full capacity, and I have received multiple requests from Isla Vista and Goleta communities for the testing site to be moved to their community for a while now. And the reason we haven't done it sooner was because the state had shared with us that they were going to not support any sites beyond August, and then that was extended to September. And we're not sure how many more extensions we'll have, but because we have the additional month, we decided that it was time to support our Goleta and Isla Vista communities. I anticipate the same level of testing, and we have not changed the testing criteria.
Okay, so it's still basically people that are symptomatic or who have maybe come into contact, et cetera, as opposed to just somebody who wants to know if they have it.
Correct. However, we ran the numbers earlier this week, and we noted that over 70% of the testers across our 3 sites have been asymptomatic. So our community members who are asymptomatic and who are not essential workers are given that opportunity to test.
Okay, and just to be clear, you don't expect any increase in the testing capacity?
No, it will still maintain the same capacity.
All righty, thank you very much.
I'd like to take this opportunity just to share with our community that our Buellton site still has capacity. We have roughly around 100 slots per day open. So that is a good opportunity for our educational partners, community members, and essential workers, and to get tested if they wish.
Thank you, Tom. And also, we've put that website address and the phone number back up on the screen for the audience. Next up, we are going to Raisa Georgie with San Ynez Valley Star, to be followed by Fabiola Navarrete with Tu Tiempo Digital. Go ahead, Raisa.
Hi, everyone. I just got an email from Lompoc Valley Medical Center. Larry Popkin puts out every week, and basically he was saying that the positivity rate he's showing is more in the 4.5% range. However, he says the state figure for Santa Barbara County, which uses other source data and rolling averages, is in 7%. So why is there such a huge discrepancy in that positivity rate change?
So what Steve reported is, I believe, the testing that is done at his hospital. Our rate that the state reports out is a compilation of all the testing that is done in our county. So that includes the hospitals, that includes our 3 OptumServe sites, that includes the public health lab, and it includes private providers as well.
Okay, and then regarding the beach closures this weekend, I'm just wondering if there has been any cases that have been confirmed from beaches this summer or in the past, and why people can't sit on the beach, or at least maybe just limit the parking lot to half capacity or something. Especially with this heat wave, a lot of people like to go get their exercise and even just relax on the beach.
Yeah, just to clarify, we are not closing the beaches. We are restricting to certain activities. So we do want for people to have the opportunity to go to the beach, walk along the beach, run, go in the water. As long as they stay active, that is allowed. We do not want people to gather and cite parties and things like that. That's traditionally very common, obviously, over these long weekends. Also, we are always concerned about our neighbors because Ventura County and Los Angeles County usually do the same thing with their beaches, and then it would really invite a lot of traffic up to our areas, and that is not something that we would like to endorse really or hasten. And there is a lot of evidence, not necessarily in Santa Barbara, but across the country, where in all coastal areas, that crowded beaches lead to increased transmission.
Risa, did you have another question? Okay, I think that was her last question. So we're going to Fabiola Navarrete with Tu Tiempo Digital, who will be our last question.
Hello. Hello, good afternoon. Okay, my first question, we know Santa Barbara is in purple, and we've heard about barber shops and hair salons reopening. But do you have any idea of when other kind of businesses will be open for indoor services like restaurants or also the gyms? Gyms, do you have any idea of when can they open?
Yes, the new state framework describes each of the individual business sectors and what they will be allowed to open indoors, depending on the color-coded tier that the county achieves by reducing transmission. So if we move from the purple tier to the red tier, there are corresponding businesses that can increase their indoor activity. Similarly, if we move from the red tier to the orange tier, that capacity will increase. And I think the advantage of the new state system is that movement is prescribed and described by the state on their website. Folks who are operating businesses that would like to know what the future could hold for them can see that in writing from the state of California. The question obviously is how quickly will we achieve as a community the reduced transmission that would allow us to migrate from one of those tiers to the next tier. And that is also limited by the fact that the state will not allow a county to move more than one tier at a time and needs to stay for 3 weeks at one level. But for the first time, there is a transparent path that businesses can look at and understand how that migration will occur over time.
Okay, thank you. Thank you so much. Okay, one more question for Dr. Answer. You say, Doctor, that 13 schools sent application to reopen. Do you know if some of them are from Santa Maria?
Yes, several actually are from Santa Maria. They are from all over, from Carpinteria all the way up to Santa Maria, all across the county.
Okay, thank you. Thank you so much. That's all.
Thank you, Fabiola, and that would end our question session.
Next Tuesday morning, the County Board of Supervisors will hear another COVID-19 briefing. This longer presentation format allows the Public Health Department to provide greater detail about the status of the virus in our community and the steps that the county is doing in coordination with other local governments and our school districts to keep people safe, healthy, and working. Our next press conference will be a week from today on Friday, September 4th at 4:30 p.m. If you have any questions, please call the 211 information line. Local information on COVID-19 and access to support and services is available 24 hours a day, 7 days a week in multiple languages. Please continue to practice these 3 simple personal steps every day. Number 1, remember to wear a face covering and stay at least 6 feet away from other people. Number 2, wash your hands thoroughly and often. Don't touch your face and disinfect surfaces. And number 3, if you feel sick, stay home. Don't go to work and isolate yourself. Call your doctor or clinic and follow their medical advice. Thank you for joining us today. Please be kind, considerate, and patient in your interactions with others. We are making progress together. We are reducing the prevalence of COVID-19 in our community. Businesses are reopening, and our community is getting stronger and more resilient every day. Thank you again for doing your part to protect everyone in our community.